Welcome everybody to SVCN's Activate Your Impact 2022 Nonprofit Policy Summit. Today is the last day. So for those of you who have been with us, welcome back. And for those who are new, welcome. My name is Dana Elneal, SVCN's Learning and Member Engagement Director, and we're excited to have you all for early childhood policy, local priorities in the context of the California budget. Before we invite our speakers up, we do want to take a moment to acknowledge the land that each of us are on today. Here in San Jose, we are living, learning, and organizing on the land of the Muwekma and Tamian Ohlone tribes. Our speakers have a beautiful acknowledgement that they'll share when we hand things over as well. We know that folks are tuning in from different areas, so feel free to please also share your native land that you're on in the chat. While we go through some guidelines, we'd love to know who's in the room with us. Please introduce yourselves by sending your name, your organization, titles, pronouns, and native lands in the chat. We also encourage folks to make sure you're sharing AYI on social media by using the hashtags AYI22, Activate Your Impact, and Driving Fearless Advocacy, and tagging SVCN and our speakers wherever you post. We've been tweeting throughout the conference and will continue to do so, so feel free to also share those tweets that you'll see. For accessibility purposes, we do have closed captioning enabled. You're welcome to enable or disable those for your own on your own screen, and you can move those captions wherever it makes sense for you. If you're having any tech or other troubles during this session, feel free to direct message me in the chat. Thank you to our sponsors, First Five with Santa Clara County, San Francisco Foundation, Destination Home, Stanford Children's Health, El Camino Health, Santa Clara Family Health Plan, Kaiser Permanente, and Healthier Kids Foundation for making this event possible. All of our speakers this week are excited to hear your questions. Please feel free to use the chat throughout the program to send your questions, and we'll try to get to them both throughout if possible, but also at Q&A time at the end. We do ask that folks remain muted for the duration of the program. We are recording this session for registrants and those who couldn't make it or may want to rewatch the recording later on. And with that, let's dive in and welcome our speakers. You can find their full bios on our AYI website. But let's bring them up right now. We have Dr. Heidi Emberling, Deputy Chief of Early Learning at First Five Silicon Valley. Leah Asuncion, Program Officer in Early Learning at First Five. Esmeralda Rosales, Director of Early Learning at First Five. And Matthew Tinsley, Director of the Strong Start Initiative at the Santa Clara County Office of Education. I leave it to you all. Thank you so much.
Good morning, everybody, and welcome to our session on early childhood policy, local priorities in the context of the California budget at SVCN's Activate Your Impact today. Next slide, please. Firstly, we want to start with a land acknowledgement. We would like to take a moment to acknowledge the indigenous people and land of the Santa Clara County area. We honor and acknowledge that we are on the traditional territories and ancestral homelands of the Ohlone Nation. The Popetla land was also the site of trading, hunting, gathering, and healing for many native nations, such as the Amon Mutsun, the Ohlone, and other native tribes. We recognize the indigenous peoples as the original stewards of the land, water, plants, and animals who called this place home. As these words of acknowledgement are spoken and heard, the ties that these nations have to their traditional homelands are renewed and reaffirmed. We respect the many diverse indigenous peoples still connected to their land and pay our respect to them and give thanks to all tribal nations and the ancestors of this place. Next slide, please. So, within the last 2 years of the state budget, and as a result of work by the legislature and the governor, we're seeing very significant changes in the early care and education landscape in California. 3 of those most significant changes that were proposed last year passed into law and are being expanded or proposed for expansion in the January budget proposal are the work around universal pre-kindergarten, the expanded learning opportunities program, and the universal meals program. So the universal pre-kindergarten program that we'll get into in a little bit more detail in a moment continues the planning and work of expanding transitional kindergarten to all 4-year-olds, ongoing expansion of the California State Preschool program, and the alternative payment and voucher-based systems, including CalWorks. In addition to expanding TK, the state has proposed and is funding The Expanded Learning Opportunities Program, the $3.4 billion proposed is in addition to the original $1.8 billion proposal that will provide 9 hours of learning and care for eligible children in transitional kindergarten through grade 6 throughout the school year, and for an additional 30 days during out of school time. So typically thought of as sort of a summer camp. In addition, the state is working on developing a universal meals program where 2 free meals will be available to every student in every school, regardless of any kind of eligibility status, thus ensuring that all children at school have access to free nutritious meals. Next slide, please. So the Universal Pre-K system is not a new program, but instead a continuation and strengthening of the existing mixed delivery system in California. It has 3 main pieces. The first is probably the one that you've heard the most about, which is the expansion of transitional kindergarten to all 4-year-olds in the state. This expansion is a gradual process over the next 3 years with 2 months additional eligibility until by the 25-26 school year, all 4-year-olds in the state will have access to transitional kindergarten. This is a program that is delivered through public schools. It's an expansion of the existing public schools entitlement for all children. And so it's provided by public schools, in public schools, by public school staff, and is available to all children in California, regardless of income. The second thread is the continuing support for the California State Preschool Program. This is an early learning program currently available to children ages 3 and 4 who are income eligible or otherwise eligible for the program. It's operated by a variety of providers, including nonprofit providers, school districts, and various other organizations under direct contract with the California Department of Education. And finally, the other existing state and federal programs that provide early learning supports and subsidies for children with a variety of eligibilities and a variety of needs. This includes programs like Head Start, Early Head Start, the CalWorks and AP voucher-based programs, and is delivered in a variety of situations, including preschool centers, family child care homes, after-school programs, and through family, friend, and neighbor care. Next slide, please. So as I mentioned, transitional kindergarten expansion is a somewhat gradual process. Not all 4-year-olds are eligible for transitional kindergarten right now, and not all 4-year-olds will be eligible for transitional kindergarten tomorrow. Essentially, what's going to happen is that between now and 2025-26 school year, progressively younger 4-year-olds will be eligible for transitional kindergarten each year until all 4-year-olds are eligible at the beginning of the 25-26 school year. Transitional kindergarten, like kindergarten, is an entitlement program, so children just need to ask, and the school districts are required to provide it. And just like kindergarten, it is a voluntary program. Public education for children in California is not compulsory until they turn 6. The other thing to know about transitional kindergarten is that it follows the school district's existing kindergarten program. Some school districts offer full-day programs, some school districts offer part-day programs. And so the exact nature of the TK offering will vary from school district to school district based on their existing kindergarten programming. Next slide, please. The Expanded Learning Opportunities Program is a new program. It requires that school districts provide 9 hours of early learning and childcare to eligible children Those are the children that make up the what's called the unduplicated count for the purposes of school financing. That is low-income foster youth and English language learner children. And the school district is required to provide sufficient slots for 50% of that unduplicated count to be able to take advantage of that program, with that requirement expanding in future years. The Elo Program Requirements, so what is required of the program and the staff delivering ELOP, are deliberately aligned with the existing after-school programs, so that existing after-school providers can simply expand their services to take advantage of this new funding stream. Schools can either provide these services directly if they have the capacity, or they can contract with community-based providers to meet those ELOP requirements. We anticipate that many school districts will choose to contract with community-based organizations to provide this ELOP program. Because all schools have a count of unduplicated pupils, all schools will receive some of this ELOP funding in order to contract, or will receive ELOP funding and will be able to contract with existing providers to provide this wrap care for the eligible children. Next slide, please. So, as you can imagine, all of these changes require a fair amount of thought and planning in order to implement, especially given the background context that school districts are operating in. And so school districts are required to develop a plan for implementation of universal pre-K that to deliver to their school boards by the end of June this year. The school districts need to describe how all 4-year-olds in the school district will have access to a full day or 9 hours of care. Note that it's a description of that care. They're not required to provide that care to all of the 4-year-olds in their district. But what it does mean is that they need to be able to articulate how that care will be provided, whether they're delivering it themselves or whether they are describing the activities of community-based and other providers in their school district. The state has released a template for schools to use with a series of questions that the districts answer in a way that help to, with the plan being based on their answers to a series of questions. The state has also provided them with some suggestions as to how to go about developing those plans, and strongly encourages them to partner with existing community-based organizations and to develop their plan in partnership with community stakeholders through an engagement process. What this means is that school districts in the county will be looking to engage with community-based organizations to help them develop this plan, which we think is a really exciting opportunity for sort of a two-way conversation between the districts and the community-based providers. Next slide, please. And with that, I will hand it over to my friends and colleagues at First Five who will continue our presentation.
Thank you so much, Matt. I know this is a lot of information that we're throwing at you in the conversation today, and it's all come from Governor Newsom's pledge when he ran for office to bring universal preschool to our state. This is now actually putting the money where his pledge was and putting it into our systems. There are two systems that are affected by this universal preschool effort. The first is the TK-12 system that we're all familiar with, and the second is the ECE system, which is 0 to 5-year-olds. There's some overlap there, of course, with our 5-year-old children, and now with expanded TK with our 4-year-old children. So any universal programs that come down to support young children are going to cross over both systems. First 5 tends to focus on the 0 to 5 realm, predominantly in the early care and learning environment. And now we're having to look at how we can partner a lot more with the K-12 or TK-12 system to think about how the move to universal preschool is going to impact our field. At the same time, the pandemic came and disrupted both systems, but in particular, our childcare system. We faced a growing teacher shortage even pre-pandemic, but since the pandemic, it's now reached alarming proportions. We have had many a family childcare home provider close down during this pandemic. In Santa Clara County alone, more than 300 of these small businesses have had to close. We've had disruptions to preschool environments. Schools are still being disrupted. Kids are still wearing masks. So obviously the pandemic is having a huge impact on our workforce. So first 5 is positioning our thinking around how we can support and bolster the early learning workforce in particular. How can we take advantage of some of the opportunities coming down from the state with expanded universal pre-K? How can we bolster the system in those first 5 years that are so important in order for working families to be able to go back to work? You can't work if you have a young child and you don't have access to childcare or early learning environments. So as we think about this and how to support our early learning workforce, we're thinking about those opportunities that Matt mentioned in these universal pre-K plans that the K-12 system has to put together before June, and how we can really elevate partnerships with the early learning field. The 3 initiatives that we're working on are a transitional kindergarten equity initiative, so making sure that our diverse early learning professionals can access those TK jobs, we call it TK here, an early learning apprenticeship program to bring new people into the field, and a shared services alliance for family childcare home owners to support both business and pedagogy practices. And I'm going to ask my team to talk about each of these in a little more depth so we can have a conversation about what this means. So I'm going to turn it, and if we can go to the next slide, please, to my colleague, Esmeralda Rosales.
So good morning, everyone, and welcome. So in the next 4 years, there will be an increase in transitional kindergarten jobs, which currently means that the new TK teachers will need to have a bachelor's degree and a multi-subject teaching credential. There are many educational barriers for the diverse, skilled early learning and care professionals who are interested in pursuing a career as a TK teacher. We live in a very expensive county, and early learning educators make close to minimum wage. They need our help to access funding without the pressure of paying back a student loan while they are pursuing their degree and credential. This is also a great way to increase the diversity of our TK through 12 workforce. Currently, 63% of our TK through 12 educators are white, while 70% of our skilled early educators are Black, Indigenous, and people of color. We believe this is an equity opportunity to diversify the TK workforce. There is currently no specialized early learning credential. So this is a great time to advocate for our TK educators to have their early learning education and knowledge as they educate our 4-year-olds. The California Commission on Teaching Credential is looking into a bridge credential that will allow teachers to teach 3-year-olds to 3rd grade. So how do we get our early educators ready for these TK jobs? Looking at alternative college pathways, internship, waivers, obtaining an emergency credential while they're pursuing their bachelor's degree, and multi-subject teaching credential. So as my personal experience, there was many challenges in order to get my degree and try to get a multi-subject credential. I was working full time. I was a single parent. So all of my educational classes was at night. I had to apply for school loans. And then there was already cohort challenges as well, as most of the people that were my cohort were also early educators. And not everybody was able to complete or pass their CBEST test, which is one of the requirements in order to continue taking the credential courses. So fortunately, I moved on with my passion in early learning field, and here I am. So if we are successful with moving on to the early teachers to the TK equity, we are working on innovating programs to bring in new people into the early care field, which my colleague Leah will be talking about. Next slide, please. Thank you.
Thank you, Esme. Good morning. I'm Leah Asuncion, and one of the workforce development initiatives that we are working on at First Five is the Apprenticeship program. This is innovative and unheard of until recently in the field of early care and education that is made up predominantly by women and people of color. Creating an apprenticeship program is our advocacy for change because first, it's backfilling the need for early educators as we move forward towards universal preschool, and it is also field building to meet the needs for better teacher quality in the early education workforce. We're partnering with a statewide organization that created many apprentices throughout California. This apprenticeship effort is an equitable way to address recruitment, retention, and ongoing professional development needs of the early childhood workforce by integrating on-the-job training, embedded tutoring, no-cost college coursework. And one key to their success is the cohort learning, with increased compensation and the intention of recruiting and retaining high-quality, skilled, and diverse workforce. In this effort, we will be including partnership with community colleges, with community-based organizations, and participating early learning and care employers. Before coming to First Five, I was a family childcare provider for many years, and an opportunity like this is beneficial not only to the apprentices, but also to the employers, because first, it ensures that early educators have the skills and knowledge necessary to implement effective practices. And it is critical to have access to education, and that education that provides wage improvement. We need multiple entry points to encourage more people in our field and field that is diverse, the diverse early learning and care field. Apprenticeship is one way for the ECE sector to grow and to also maintain the workforce while expanding knowledge and the skills and earn higher wages, serving the young and the vulnerable population, our young children. Now to learn more on how to strengthen the infrastructure that support early care and education sector of our community, let's hear it from Dr. Heidi Emberling. Next slide, please.
Thank you, Leah, and thank you, Esme. So Esme talked a lot about our TK Equity Initiative and how we're working with 4-year-old teachers who would like to work in an elementary school environment. We want to help them do that. Leah talked about our pipeline for getting new people into our field through our apprenticeship effort. And our third big ECE workforce effort right now is the Shared Services Alliance project that we're working on with the County Office of Education. And that is that how can we support our family child care home providers in this county who often serve our youngest population, our infants and toddler population? How do we help them run their, support their micro businesses? How do we help them with their ongoing educational desires? So the business supports potentially through the resource and referral network that already exists. How do we incentivize people to start new businesses? How do we strengthen businesses that currently exist and help them surmount barriers, certainly barriers that have come with the pandemic? In terms of business supports, we're looking at enrollment and tuition management supports, marketing tools, access to health insurance. How do we look at benefits for our family child care home provider teachers? Substitute pools, it's something we don't really consider in the elementary environment because they have substitute teachers on staff. But when a family childcare home provider gets called for jury duty or gets sick, or a family member gets sick, they have to close, and all families then do not have access to care. So then they can't go to work either. There really isn't any kind of infrastructure for finding substitute teachers who can help keep these childcare provider homes open. And then retirement supports, tax supports, legal guidance, it's endless, right? The early learning field doesn't have administrative infrastructure like the K-12 system does. They have superintendents, associate superintendents, student services coordinators. We on the ECE side don't have that built in. So how can we as First Five and the County Office of Education work together to elevate these businesses, support these predominantly women, predominantly Black, Indigenous women of color to be successful in these small businesses, and therefore allow more families to go back to work and get the economy going. So we're looking at creating the Santa Clara County Family Child Care Network within which we can provide these business and pedagogy supports. So that's a lot, but let's move to the next slide, which I think we'll be talking about ways in which you can activate your impact and our call to action for things that you can elevate at your various nonprofits. And I'm going to turn it back over to Dr. Tinsley.
Thanks, Heidi. So while you're thinking about everything that that Heidi has suggested and all of the changes that are happening at the state level and reverberating through our local ECE community, here are some things for you to think about with starting with your own organization. So I think we spend a lot of time thinking about policy and advocacy and how to move legislators and policymakers in the direction that we want to go. But we also have the ability to improve the situation for children and families within our own organizations. So thinking about paid family leave and whether or not you provide paid family leave for your own employees, whether or not you provide this as a benefit that goes beyond the minimum requirements of the state. Thinking about transitioning back into the office and whether or not you'll continue to provide telework opportunities for your employees. We've all seen jokes about how it's difficult working with children from your bedroom or from your living room, but it's actually much more difficult working if there's nowhere safe for your children to be while you're at work. And we know that for many families, the opportunity to work from home has made raising children, it's never simple, but simpler. And finally, among your suite of employee benefits, do you include a dependent care account that allows your employees to save money for childcare tax-free? And then spend that money to buy higher quality childcare for their children. As you think about your advocacy strategy around your own particular issues, think about how it interacts with early childhood education and the needs of children and families. Without doubt, the issue that you're working on has an intersection with early childhood education and the need for high quality care. In order to really understand that intersection, what are the things that you and your organization need to know about early learning and care? And who might you reach out to get that information? There may be some people on this call or in this presentation who could help you learn what you need to know around early learning and care. And finally, does your advocacy strategy explicitly acknowledge that intersection, and does it address that intersection? When you are advocating for affordable housing, for example, are you advocating that early childhood facilities be part of the affordable housing development? This won't just benefit early childhood education, but this will benefit your issue as well. And then finally, a few sort of broader points around advocacy. As I'm sure you know, advocacy is based on building relationships. We all have limited time, and relationship building and management takes time. So you want to make sure that the people that you're building relationships with actually have the power to affect the issues that you are interested in. Certain issues are dealt with at a state level, certain issues are dealt with at a county level, other issues are dealt with at a city level. So are you making relationships with the people who can actually affect your issue? How can you improve their understanding of these issues? What do they need to know in order to really appreciate the urgency of the issue, the nuance of the message that you're trying to deliver? And finally, what are the specific things that you want them to do? What is your ask of these people? And is it something concrete enough that they can act on it? Building awareness of an issue is a necessary first step, but it's only the first step. And after awareness building comes sort of advocacy around specific actions, specific issues. And that's where hopefully we can really start to affect change. So those are some suggestions on how to think about ECE and how to activate your impact more broadly. And with that, I believe we're going to move to the Q&A part of our presentation today.
Yeah, and I think we invite all of you to think about some of those questions that Matt just raised. How is your, and we can close the slideshow. Thanks so much, Marissa, for your help. We can certainly hear you live. We have some time to have a conversation. We're a small enough group to hear what your organizations are doing, or even for those of you who are parents, how are you thinking about access to childcare, early learning, universal pre-K? What do you know? What questions do you have? This is a great opportunity for us to have a conversation about it. We appreciate all of you for being here today.
Looks like there's some questions coming into the chat.
Great. Nick, do you want to share your question out loud, or?
Sure, that would be great. So I know I got a chance to have a separate panel with you all. So I got to pick your brain specifically about this, but I know that you had really impressed upon me the importance of providing service for children as an underpinning for so many nonprofits, and to be able to deliver services and do the things that they do, because we have families. I'm one of those people. Can you speak a little bit more about how nonprofits who aren't traditionally in the early childhood education space, how they can get involved, what they can do? I know Matt, you went through kind of a list of like a self-assessment, but like, what can they do to kind of push some of these really great things that you guys are all doing?
Sure. If you like, I'll start up, and then perhaps I'll defer to Heidi afterwards. But so one of the things that has been sort of a key learning for me over the sort of the decade or so that I've spent in early childhood education is just how foundational an issue early childhood education is to a lot of the things that we think about, to a lot of the things that we care about, right? It's difficult to be more upstream than programs and services for children 0 to 5 and their families. So one of the points that I made was thinking about how your issue intersects with early care and education, because it almost certainly does, right? And the example I just gave was one around housing. Like, people who live in affordable housing, just like everybody else, needs to have somewhere safe to put their children when they head off to work. they need to have somewhere relatively convenient, somewhere accessible and affordable. And in fact, access to childcare is one of the most in demand resident resources. So when you think about building affordable housing for families, including an early childhood facility in that development, so that access to this key service is built right in, is a place where ECE and affordable housing come together. I was on a webinar yesterday where I learned that the majority of children referred into foster youth services are referred in before the age of 3 and are referred in because their parents are, because of the risk of neglect. And typically what they mean by neglect is that the parents leave them somewhere that's not safe because they have to do something. They have to go to work, they have to run errands, they have to be somewhere. So if we could provide childcare to children at risk for neglect, it would dramatically reduce the number of children referred into the foster youth system. And so for those of you who work in foster youth and adoption, access to quality infant toddler care is again one of those intersections that has a dramatic effect on your work. And there are a number of other, other similar sort of intersections, right? We know that access to early care and education reduces special education identification rates. We know that children who go to high quality early care and education programs are less likely to be arrested for a crime at some later point in their lives. Early care and education has the capacity, the ability, the demonstrated ability to affect a whole host of social issues that we care about and that nonprofits work on. And so I think there's an opportunity for organizations that are interested in these downstream issues to work on an upstream intervention in collaboration with the ECE community that is already here. Heidi, do you have any additional thoughts?
Yeah, always. I would say another big issue that Esme and Leah and I are working on as an early learning team here at First 5 is the issue of quality. We want to make sure that everyone has access to high quality early learning experiences because decades of longitudinal research show us that it's the quality of the early learning environment that really makes a difference in a child's life. And so we're looking at, we have a Quality Matters initiative. We have about, Esme, you know the numbers, current numbers, we're somewhere around, tell me.
If you're talking about family childcare providers, we're a little bit over 550 family childcare providers in the Quality Matters system.
And centers too?
And we have approximately about 120 sites.
Right. So all of these folks who have entered the Quality Matters system are committed to continuous quality improvements over time. And so we're looking at not only how do we increase access to childcare, and Kira, I'm looking at your question too. Not only do we increase access and move towards universal access, but it's also to quality and affordable quality environments. There are a lot of issues that if you're interested, we can certainly talk about in terms of affordability and whether people qualify for subsidized care or not, because that's a whole other issue. There's a lot of people in Santa Clara County that might not qualify for subsidized care, but also can't afford full fee care because childcare is expensive. So we're looking at programs that help people access quality in a variety of ways. I think what we're talking about with our TK Equity Initiative that Esme so eloquently laid out is how do we make sure that our skilled child development experts are teaching those 4-year-old children? Right now, there is a credential barrier. The credential barrier is that they have to have a multiple subject credential, which allows them to teach up through 8th grade, meaning they have to learn how to teach every subject across grade levels through 7th and 8th grade math, science, language, literacy. And some of our early educators are only interested in early education. We want to make sure that those 4-year-old TK teachers are really focused on child development knowledge. And so this early learning bridge credential that the California Commission on Teacher Credentialing is considering right now, again, as Esme stated, would be covering ages 3 to 3rd grade. So you could teach in an early ed environment, 3-year-olds to 5-year-olds, or you could teach in an elementary school environment, TK to 3rd grade, TKK 1st and 2nd grade. And that credential might be more of interest to our skilled early learning diverse professionals for those TK jobs. So that's all about that first initiative we're doing. But overall, as TK expands and we have more and more 4-year-olds coming into our public schools, how are our current preschools and early learning environments morphing in terms of figuring out whether they need to start serving younger age groups, and then what does that care look like in terms of quality? And so First Five is actively approaching the issue from those angles as well. And also we want to think about our children with additional needs. Are the environments meeting the inclusivity needs of our children and families? Are the teachers equipped and getting the education that they need to support children of all different abilities in the classroom? We're looking at dual language learning supports, and are our dual language learners receiving the supports that they need in early environments? So we're looking at readiness across a wide variety of indicators as we think about how we support children to thrive before they get into that educational, the K-12 system. Those are some early thoughts I had, but what other questions do you have? And Kira, not to minimize your question at all, because I definitely think that it is transformative that we are moving towards universal access to 4-year-olds education, universal preschool. It's certainly never been done here before in this way, and it is going to fundamentally transform not only the TK-12 system, but also the 0 to 5 early learning system. So again, it's this crossover. That 4-year-old crowd is sort of the crossover between two systems and also two state departments, right? We have the California Department of Education that does elementary on up, and we have the California Department of Social Services that does 0 to 3. So we're also having to navigate across two statewide systems as well as we think about the impact on community. And Nick, I see your hand.
I'm sorry, I really don't mean to dominate. I'm just really just hooked with all the things you guys are saying. And one of the things that, you know, my family has been dealing with, a lot of families have been dealing with, is the fact that a lot of the children we're targeting for pre-K are currently unvaccinated. And you know, a lot of us are, it feels like a lot of the work here is to provide the services for individuals. And I pray that by the time the services are available, that we're just gonna not have to worry about COVID. We'll just be able to rejoin society like normal. But is there any sort of concern from you all about how not only to provide the services, but then to get kids in those services, get families, feel comfortable about putting their kids into those services, so they're in a safe environment?
Oh, absolutely. That's such an important consideration, and so interesting, because at yesterday's First Five Commission meeting, we got to hear about our new Potter the Otter book, Potter the Otter Gets a Vaccine, which will be coming out in the next few months as the vaccines become available to the 0 to 5 crowd. So we're also thinking about that. One of the benefits of working at First Five is that I brought you our early learning team experts today, but we also have family strengthening and support department, and we have a community health and wellness department, community of learning department. So each each of our different teams is working on different aspects of helping children to thrive in these first 5 years. And so we're definitely looking at intersections between health and early learning and family strengthening and support, and how we can, as an agency, have systems talk to each other, work together to assuage families' fears, address issues that are coming up. So we're having a lot of those very energetic and enthusiastic conversations as well. I think, pandemic restrictions have been very hard on the early learning field. We were among the first asked to get back to work to provide essential childcare for other essential workers in the health field and elsewhere. Often the, canaries in the coal mine, early learning environments were open. Let's see, we closed down in March. We were open pretty much by May. Many sites started open. We didn't have a vaccine for, another almost year, and yet they were still coming to work every day, trying to figure things out so that people could go to work. I think we can't underestimate the unsung heroes here in the early learning childcare field. There's been an ongoing need not only for stabilization funding, but also for PPE and at-home tests. The federal government just sent us all 4 at-home tests. Our providers have maybe up to 10 kids, up to 3 educators. And none of them, to your point, Nick, are vaccinated in the 0 to 5 age range. So if you want to do active testing, that's 13 test kits per week. If you think about the cost of these tests, which is about $30 right now, you're talking about substantial costs put on people making minimum wage, caring for children so that others can go to work. It's endless, the types of things and advocacy that we need in the field of early care and education. Thank you for bringing that up, though, that intersection. And I know that my colleagues at County Office of Ed have been deeply thinking about how to support these communities as well. Matt, do you want to add something there?
Well, so it seems a little tasteless to talk about a silver lining when we've had, close to 1 million people across the country die from COVID, and countless numbers who will be facing sort of long-term consequences and potentially permanent disability. Having said that, one of the things that I think the pandemic has really underlined is just the critical importance of working families having somewhere safe to put their children. The custodial care aspect of K-12 education is something that we typically don't think about, particularly as education professionals, right? We tend to focus on sort of academics and more recently to sort of social and emotional learning. But it has really underlined the importance of the having somewhere safe, right? I don't think the governor would be talking about funding a 9-hour day or 30 additional days of care through the Elo program, absent that realization. And I think it's also been clear that access to care for children 0 to 5 is critical for working families in exactly that same way. So that has been, I think, a driver of a lot of policy. The recognition of childcare workers as essential workers, I think, has been a real recognition. And just to touch on sort of Kira's question about transformational, I think the addition of a whole new grade in public education doesn't come along very often. And it truly is transformational, right? Because for the first time ever in California, and I think certainly on this scale anywhere in the country, education for all 4-year-olds is now part of their right as as a citizen of California. It's not contingent on ability to pay. It's not contingent on family income or your location. If you are a 4-year-old in California, you will have a right to publicly funded education. That in and of itself, I think is pretty important. But in addition, it creates a linkage between public education and what we have traditionally thought of as early learning, services for 4-year-olds. That linkage will help to drive sort of a two-way alignment between what we expect of early learning and care and what we expect of K-12 education. I think there's been a lot of thought about what it means for preschool and for transitional kindergarten. I think there has been less thought about what it means for elementary education, right? What effects will it have on 3rd grade now that every 4-year-old has had access to public education? I think that that two-way transformation, right, is potentially really important. One of the things that early care and education does really well is support for individual children, whole child approaches. These are things that K-12 education typically hasn't done as well. And so I think bringing some of that early care and education mindset into K-12 could be incredibly important. The other thing that it does is it brings the early care and education sector into a big public system, and a big public system that connects with other public systems, right? Delivering behavioral health services to children will be considerably easier now that those children are attending a public school and in TK.
So Matt, I'm sorry to interrupt you. We
Yes,
have a
yes,
few more questions and we're running low on time. Do you mind if we turn to?
No, not at all.
Oh, thank you so much. But I mean, I'm as riveted and as always, and I could talk about this with you obviously forever. So, but Lisa, let's invite your voice in.
Thank you. I want to be respectful again of the other two that have their hand raised. I'll just make this quick. My name is Lisa, pronouns she and her. I'm with the Behavioral Health Contractors Association. I really appreciate what you all were talking about as far as workforce shortages and the fact that this is something that's been there prior to COVID. You had mentioned 8,000 to 10,000 new teaching jobs in the next 4 years. I appreciate some of the innovative ways you were talking about kind of targeting that educators and to kind of entice them into the field. And I really did appreciate, I think, what was said about the dependent care account. That's a very kind of innovative and creative way. What are some other kind of innovative and creative ways that you all are thinking about attracting folks into the workforce?
Sure. Well, our biggest initiative right now is the apprenticeship. Traditionally, fields for apprenticeship or that were deemed apprenticeship worthy in terms of being a highly skilled profession are more trades, transportation field, airplane mechanic, things like that. And with the work that's been done in other counties throughout the state of California, this is a new early learning apprenticeship where people get a full-time job in addition to their first 4 child development courses that put them on the path towards becoming a teacher. So they'll be getting coursework free of charge and a paid job. This is our pipeline creation in Santa Clara County, and it's just never been done before. So that's probably our biggest innovative program, and we have a few others, but certainly we'd be happy to answer any other questions about that one. We're also looking at the early learning bridge credential as a way to help our early learning professionals access education to fulfill those credential requirements, and then they'll be well positioned for those new TK jobs coming down the pike. So again, those all sort of tie together in how do we increase interest in joining this pipeline. Thank you for the question. And Laji Tueva, sorry.
Lonnie, thank you. First, I want to acknowledge the full conversation. I appreciate the diversity and the importance of understanding the silver lining in the work that we have amongst toddlers and TK and 12th grade and college universities. I kind of just want to acknowledge that, and I just want to express that today my focus mainly is now, where does my advocation help in listening, understanding further, so that I can know the material and I can know the direction of where we're going to put the support for the upcoming generations, especially using the advocation that we already have as experience and expertise and elite expertise, and the value of different people bringing that kind of support to this network. So I just wanted to acknowledge that I completely agree with the conversation. There's more conversations to be elaborated later on, and I'm definitely focused on those. So it's a great pleasure to be amongst you guys and truly take in what the main focus is as far as being part of your team. So thank you.
Thank you so much for your comments. I know we're running low on time, so Dan, I wanted to hand it over to you. I think you had some closing comments.
Thank you all again to so many of our speakers for sharing that. And someone who admittedly knows very little about this space, I know I learned a lot, and I think I'm processing a lot as well. So we appreciate all of the insights that you all shared with us this morning.